Are you dealing with low back pain? Wondering what you should do? Today in this video, I'm going to go over some of the steps you should take to try and help relieve your back pain and what progressions you should take if it's not getting better. So, one of the first things you should do if you start experiencing low back pain is try to get up and get moving a little bit more. Go for a walk. Get out and go 5-10 minutes and see how it feels. A lot of times, just by getting moving a little bit more, that's going to help relieve some of these back pain issues that we have. One of the things that we know about back pain is it tends to be uh, short-lived in the beginning. It comes and goes. And so if this is your first time dealing with back pain, try and see if doing some movement helps. And if that helps, great, keep doing that. That's the biggest thing, is we want to find things that improve it. And if we can find those things that improve that pain, then continue to do those to get that relief. If the movement, getting up and moving, doesn't seem to be doing much, then the next step would be going in to see somebody. Now, oftentimes when people have back pain, the first person they're going to go to is their primary care. And you're going to either get a muscle relaxer or a pain medication and maybe referred out to a specialist who's then either going to offer an epidural injection or surgery. Now, all these things, if done at the right time, can be beneficial, but at the same time, those are some of the more aggressive types of treatment and should be done a little bit later on after other things have been tried. So what the order I always like to do things is try and move, see if doing different movements, walking, exercising a little bit doesn't help. Now, the exercises should be gentle exercises, body weight types of exercises that aren't super aggressive, super explosive. And then going to see a chiropractor or a physical therapist that can help with those things. Now, oftentimes what I find is when I'm dealing with somebody with low back pain, there's a couple different components that are involved. One, a lot of times the joints aren't moving. So you have what's called a mechanical joint dysfunction, which is causing some of the muscles to tighten up. And so you need to address both the muscles and the joints. Loosen some of the joints up, get them moving, get the joints moving properly, and then that starts to allow you to move properly. So trying those options. And if those don't work, then the next step might be going and doing acupuncture can be beneficial. Some of these other non-invasive types of treatments. And then going and getting maybe a medication, a muscle relaxer to see. Or a pain medicine. And then the next step from there would possibly be an injection, an epidural injection to give you relief. Now, the epidural injections, they're questionable about how much relief they can help or give to a person. Most of the research shows is that an epidural injection has short-term relief, maybe 2 to 4 weeks, and there are side effects to that. You could potentially get an infection in the site of the injection. It could potentially hit a nerve and cause some nerve issues. And so that you want to be careful about just jumping right in and having that done. After the epidural injections, then the next step would possibly be a surgery. And that's the most aggressive and has the most side effects and the most possible potential permanent damage that you just can't come back from. And so always starting with the least aggressive and the least side effects is the best way. And so start moving, go to the chiropractor, go to the physical therapist, see if those things help. Try acupuncture, try dry needling, see what happens there. Then maybe try with medications, see if you can't get a little bit of relief from there. If somebody comes in to see me and they're just in such pain that I can hardly even touch them, then maybe we'll try some of these other more aggressive things like medications or an epidural injection to at least decrease that pain initially so that then we can work with them. But surgery should always be your last option. So if you haven't tried anything else and somebody is suggesting you need surgery, try some of these other things, because even if with severe pain, maybe pain going down the leg some, there are things that you can do to help relieve that. And the only time that surgery is maybe your best option is if the pain is going down the leg and it's just unrelenting, not getting any better, you're starting to get weakness in your leg, then maybe surgery is your best option. But it's not something we should be jumping to right away.